Are you labeled as an azoospermic male? Then what are the chances of fathering a child with your own genes? To know this, please watch this video. I am Dr. Sirisha, gynecologist from Avira Fertility Hospital. So labeling a man as an azoospermic is a very painful thing for him to digest this diagnosis. So before labeling a man as azoospermic, you have to confirm this diagnosis by doing at least 2 semen analyses, that too a centrifuged semen analysis with a gap of 4 to 6 weeks to confirm this diagnosis. So what is azoospermia? Finding no sperm in the seminal fluid is said to be an azoospermia. Then why does this cause? Many queries comes to us that we are absolutely healthy, doctor. Then how come this possibility is there? So there is an absolute possible that even though if you are a healthy male, there can be a chances of azoospermia. So what are the causes for this azoospermia? So the most common cause is non-obstructive azoospermia, and there are two variants, non-obstructive azoospermia and obstructive azoospermia. As you all know, the sperms are produced in the testes and sperm cycle starts for every 90 days. That means a new batch of sperms are produced in the testes for every 90 days. So when there is an insult for the testes, so there can be a low sperm production or nil sperm production. At the same time, these produced sperms has to pass through a channel to come out. So when there is an obstruction to this channel, it is termed as an obstructive azoospermia. So what are the common causes for this obstruction of this channel? The most common cause for the obstruction of this channel is infection. So the infection is in that also the most common thing will be the sexually transmitted diseases. The sexually transmitted diseases, especially gonorrhea and chlamydia, causes obstruction to this channel, therefore causing an obstructive azoospermia. So a poor knowledge regarding the safer sexual practices and taking under treatment for this infection results in the obstructive azoospermia. In fact, there are production of sperms in the testes. Since due to the blockage of this channel, these sperms are not coming out. So first thing, the other most common cause for this obstruction is trauma. The trauma can be an accidental trauma or surgical trauma. For the surgical trauma, the most common surgery is the vasectomy. Vasectomy is a permanent male sterilization procedure in the case leading to a secondary infertility. When these patients wanted again a parenthood, we have to go for a microsurgery reversal procedure. In fact, if they opt for an IVF, we can go for a aspiration procedures, that is TISA. TISA is nothing but testicular extraction of sperm aspiration. If it fails, we go for a higher procedure called TZ, testicular extraction, testicular sperm extraction. So in these procedures, they can definitely become a father again. The other thing is a non-obstructive azoospermia. Non-obstructive azoospermia, as the name suggests, there is no obstruction in the channel. In fact, the production of sperms in the testes becomes nil. So again, these can be classified into two variants, a testicular variant and a pre-testicular variant, where the fault is completely in the testes level, leading to no production of sperms. So if there is no problem in the testes and the problem is in the hormonal production in the brain or some other cause leading to the no production of sperms in the testes, that is termed as a pre-testicular non-obstructive azoospermia. So we have to find out what is the root cause for this azoospermia. So like coming to an obstructive testicular level of azoospermia, the most common cause of testicular level azoospermia is mumps orchitis. Mumps is a viral infection coming to an adolescent boy, basically infecting the parotid gland, making them sterile. So and the other most common cause is the STD infection leading to orchitis. Otherwise, the other common causes will be testicular torsion, varicocele. All these things can lead to this testicular orchitis. The other more common things will be the chemotherapy and radiotherapy. Chemotherapy and radiotherapy is a part of the cancer surgery, making the man sterile. So before going for this chemotherapy and radiotherapy, a man should opt for a sperm freezing. The sperm freezing is a newer technique where they can store the sperms and can be reused when there is a necessity. So the other causes will be the pretesticular causes. Coming to the pretesticular causes, due to the hormonal problems, there can be an azoospermia. The FSH and LH are the two major hormones produced in the pituitary gland of the brain, which controls the spermatogenesis in the testis. So when there is a low production of FSH and LH, as we see in many genetic syndromes like Young syndrome, cystic fibrosis, and other causes of hypogonadotrophic hypogonadism. So we see low production of sperms or no production of sperms. So in that cases, we have to opt for the donor sperms. So the other most reversible azoospermia cause is the hyperprolactinemia. Prolactin is a hormone which has an effect on spermatogenesis. High prolactin levels leads to azoospermia. So when we find this hyperprolactinemia, we have to do an MRI of brain to find whether there are any microadenomas or macroadenomas producing prolactin in the brain. So when we find the microadenomas and macroadenomas, we opt for surgery. When you don't find microadenomas or macroadenomas, still your prolactin hormone is higher, we have to reduce it by medical treatment. So your azoospermia can be completely reversed. So you have to know what is the problem, where is the problem for your azoospermia. Knowing this condition can be completely reversed or treated, and you have a specific treatment regimes to treat this azoospermia. If at all, you can go for a donor option. Thank you.